I've always led a very active life: football, wrestling, basketball, track, baseball. I had 7 surgeries, and I was between the hospitals, the surgeries, and just IV treatments. I was there 187 days in 2012. We had the discussion. He said, well, I had the time to make the decision, so I decided to have him amputated.
When I first met Mike, he was in a challenging situation that he had had a few surgeries to try and get his ankle joint to fuse, and had run into complications that not only had the bones not healed together, that he had also run into an infection afterwards. And so all of the hardware that he had in his ankle had to be removed. And so by doing the amputation, we were able to eliminate the area of pain as well as the infection that he had in his ankle. It takes a couple of months to get through an amputation, that it's not a quick fix. But once the incisions have healed up and the swelling in the residual limb is down to a stable level, then they can get fitted for their new prosthesis. And I remember Mike walking in with his new prosthesis, without any pain, with an incision that was healed up and not causing him further infections. And that was a good day for both of us. And he really has done great with his amputation. He's back to riding his motorcycle. When he walks down the hallway, it's impossible to tell which side is the amputated side. And it really has turned out to be a great improvement in his quality of life.
I started working with Mike just as he got his new prosthetic leg. Mike was special in that he was extremely highly motivated, very active, had an active lifestyle. We kind of jump on the physical therapy side right at the initial point when they're looking at kind of deciding what type of leg they want to get. We help them to make that decision by looking at what they used to do activity-wise and what they have the potential to get back to doing. It is great that we're all here in the building. I mean, we're all just a hallway away, so if there's ever questions or concerns, it's easy just to run down and grab one of the prosthetists or go over and talk to the doctors.
On a day-to-day basis, we evaluate individuals for prosthetics, talk to them about the pros and cons of different suspension systems, different feet on the market for their functional level. Mike elected to go forward with the amputation due to the severity of the pain that he was experiencing. Knowing that Mike was an active individual kind of puts the pressure on you, because he wants to get back up, golfing, playing sports, hunting, fishing. He had grandkids that he wanted to play with. A lot of amputees have a hard time figuring out where do they go from here. Well, this clinic definitely helped transition these patients in the right direction. We all have a system and know our role. It just makes the quality of care much better. Everyone's more efficient.
So I was approached at the beginning of the year by Brian at Clark Prosthetics about meeting to form a prosthetic clinic. He had seen a number of patients who seem to have lost their way, or they don't know how to go through the process of getting the prosthesis and then the ongoing management of that throughout their lifetime. And so he talked with Dr. Eckroth and myself, as we do several amputations as well, and we met and the prosthetic clinic was formed. After I see the patients for the initial visit and we get the process started for the prosthesis, I follow the patients regularly every 6 months in the prosthetic clinic just to make sure things are going well, they don't need any different equipment, truly lives up to the PCI standard of being together and health.
In the 4 years previous to me getting my leg, I was the slow one. I was the one that worried about where I got to, and I knew I could walk, but I didn't know how far I could walk. So I always governed myself. When I had the surgery, I was ready for it, but after I got the leg, it increased my mobility 100% basically, and I've gone motorcycle riding for a week. I've gone to car races and walked 6-8 miles in a day. Nobody's waiting for me. It's well worth it in the end because you get your life back.